why you want to learn this, because the entire perspective of teaching and getting into a course is to understand from the client or the student perspective, why do you want to do this basically. So we have Sintha Matthew. Sintha Matthew, if you can come quickly for 15 seconds, introduce yourself and why do you want to learn this course. It will help us to understand a little more better.
Yes, ma'am. I just completed my post-graduation in food science and nutrition, so I don't have any experience. So
No problem. But
particularly,
what excites you with this topic? I mean, why did this topic? Why did you why you wanted to understand about nutrigenomics?
uh, as I told you, I don't have any experience, so I just want to know what is all these things. It's
Great.
all
I
new to
think
me. Okay.
you in this workshop. Probably then you can take it ahead from there.
Yes.
We can go to Shruti. Shruti, if you're there, if you can quickly just unmute 10 seconds, introduce yourself, and let us know where are you from, what do you do, and why this topic.
Hi, Ankita. Good evening. So, I completed my master's in food science and nutrition from National University of Singapore, and I'm currently working in the field of nutrigenomics as a nutritionist, as well as a genetic consultant. So, basically, I was interested in this field because, as we say that diet is not one size fit all, and nutrigenomics is basically the amalgamation of both your genetics and the nutrition. So whatever you eat is based on the gene and the DNA. So this particular field is going to be a booming field in the future, where everybody will be looking forward to learning about more about their DNA and more about how each food and each nutrient interacts with our DNA, and how the DNA also impacts our overall health. So I was very interested when this workshop was put up in the common group. So looking forward to it. Thank you.
Great. Thank you so much, Shruti. And it's really nice to know that you've been working already in this field. Anita, if you can just quickly introduce in 10 seconds, where are you from, what have you done, and why this course?
Good afternoon, everyone. I am Anita. I have also completed my PG in food science and nutrition. I am a fresher, so I wanted to expand my knowledge in these topics. That's why.
Wonderful. Uh, can we have Himaja?
Yeah, yes, ma'am. Great evening. This is Himaja. I'm senior functional wellness coach. We help clients to reverse their metabolic disorders. So I was interested to know like what is nutrigenomics and what are its basics, and with this, how can I help my clients in the diet part? Yeah, so that's why I'm here.
Wonderful. All good to see you. I mean, and all good to see you here. If I've missed anybody, please feel free to unmute yourself and please take the 10 seconds. We'll just start in 1 or 2 minutes. I'll hand it over to Fatima to start the workshop, probably, and we can all flow into it. So we just have another couple of minutes if anybody wants to unmute and just introduce and say why this course, if I have missed taking anybody's name.
Also, we request Charu to confirm कि सबने join किया है कि नहीं. Then we can start, or we start again.
We can start, I think, Fatima, because it's already 6:10, and probably I think, most of them have joined. We are 14 of us.
Who have joined now, who have paid for the course?
Yeah, they have. That's what. So, but we can start. I think they can join in. It's already 6:10 because we had already given a time of 6.
Yes.
10 minutes buffer.
All right. So over to you, Fatima.
Yeah, thank you, Anita, for warm welcome and getting each other familiar. So I think most of us are very fresher, but few like Shruti knows about the nutrigenomics. So today you will get more depth about nutrigenomics, about genes and nutrient interaction. Along with that, you will also get to know about the diseases which are caused because of mutation and how to deal with them. So we are giving you two aspects at one time, like how you can use genetics and nutrition for preventive measurements, and also how you can treat any genetic mutation or disorders whenever if you get any clients, because these are very rare cases, and if you are specialized in these cases, you have uphand amongst the other nutritionists. So without wasting much time, we can start our session. Just do let me know if my screen is visible.
Yes.
Yes, Fatima. Yes, we can see your screen.
So is it moving?
Yes.
Yeah.
It is
So
visible and audible.
yeah, thank you so much. So like everyone knows, like when two people eat the same food, does that same food have same effect on each one? Yeah. Can anyone answer? Like if you have a two-person eating the same meal all day, whether it's give the same reaction or same benefit or something else.
Well, I believe it depends on person to person.
Yeah. So why is that? Why it gives like variation person to person? If I give 1,400 calories to a person X and also person to Y, why it happens कि he may lose 2 kg but he may lose only 1 kg or half kg? Why is so?
Uh, Various reasons, body metabolism, age factor, genetics,
Yes.
cause.
Right. So there are multiple factors, and when we look into deep dive in the science, we get to know that all these factors revolve around our DNA and genetic material. So likewise, we say nutrition isn't one size fit all. We can't give one diet plan to everyone and say, yeah, you will get cured of or you will reverse your diagnosis. But we have to make a tailor-made diet and give it to everyone because it's all coded in our DNA. So each person's DNA is different and each person's response to the diet or any kind of food is different. So welcome to the world of genes, food and health intersect. And today we will unlock the understanding of genetics that can transform the way we approach to diet, disease and well-being forever. So before we start, I would like to give a brief introduction about the faculty which are going to teach you, and since you should know them so that you get much more this trust on them. So we have Tanvi. She is a clinical dietitian, certified nutrigenomic counselor, and she has an experience of 20 years. Then we have it's myself, Fatima Radanpurwala, registered clinical dietitian, diabetes educator, certified nutrigenomics counselor. I have experience of 15 years. Then we have Deblina. She has an experience of 15 years again, and she's a clinical dietitian and certified nutrigenomic counselor. She is pursuing her PhD currently. And we have Ankita, which has a beautiful, she has beautifully started our session. So she's a clinical dietitian, sports nutritionist, certified nutrigenomic counselor, and she has experience of 14 years. And we also have Ritika. She is clinical dietitian, certified autism and ADHD nutrition therapist, and a certified nutrigenomic counselor with experience of 6 years. So we all have done a nutrigenomic counseling course and we are working in this field. So we hope we can help you much better to understand this uh, concept of nutrigenomics and the disease. So I would like to say ke, Tanveer, Deblina, Ritika, just on your cameras and say hi to the people so that they get to know we are here.
Hello, everyone. This is Tiblina, and I will be taking your metagenomics part. So it's a very exciting, though a very deep-rooted part. All those who are practicing in nutrigenomics field must be aware that how a simple swab sample also can help us to identify the complete genetic history of that individual, and not only that, that can actually help us to understand which medication is going to act good or bad, or which meals are going to give the best result for that particular therapeutic condition. So I will be taking that part, and definitely, as Ankita said, that this is a workshop, you will get an overview of the things, but to get a deep understanding of the things, we will suggest you to enroll for the entire course so that you can get a proper certification of that. Welcome you all. Have a nice time today.
Yeah. Tanveer?
Hello, good evening, everyone. So I'm Tanveer. and I'll be taking your nutrigenetics and nutrigenomics, so which is future of precision nutrition. So I'll be dealing with these things, whatever genes are required for your proper functioning of health and medical problems. You can just advise with precision nutrition. You can prevent diseases and you can improve performance of athletes and all. So I'll be taking nutrigenetics and nutrigenomics with you, and I'll give you overview in this session also. Thank you.
Ritika?
Hello all, this is Ritika here. So I will be focusing more on the rare genetic disorders that we will be seeing in this workshop. So I will be mainly focusing on the type of the genetic disorder. Some of them are picked up, but I will be giving more details and everything once, like if you're interested in joining the course. So I'll be giving the gist about the genetic disorders, what are the diet principles also need to be followed, and its prevalence also. Thank you. Good to see you all.
So yes, as we discussed, we will first interpret the genetic codes. We learn about the basic of genetics, because this is a thing which we have learned in the college. Kabhi kabhi bhul jate hain, so we will have brushing up to it. Then we will explore the inborn errors of metabolism, which are a kind of genetic disorder but needs to be dealt differently. Then we will also learn about rare genetic disorders. Secondly, we will learn about how to apply nutrigenomics, how we can apply in a day-to-day life with our clients to help them better. And we will dive into metagenomics, like Deblina told. She will be taking a deep, explaining you very clearly how the metagenomics works. Apart from these topics, at the end of the workshop, we will be having a small assessment in the form of a quiz, wherein you can assess yourself how much you have learned, and also it will be a fun kind of it. So be there till last with us. So I would hand over to Ankita for the session to start. So do you want to share your slides? Or
I can share, Fatima. Yeah, I can share because I think that would give me a little more comfort.
Sure.
So probably
I'll
I'll
just stop sharing.
Yeah, I'll just share. Just let me know if it is. 1 second.
And it's a request to all. If you have any questions or if you feel you want to ask something, either you can raise your hand and ask, or you can just put in a chat box. So maybe we can take it up later, or once the one session is over, we can take it up, right?
No, Fatima, I think we can take it in the end, all the questions. That would also help us also to get the flow correct, and probably the questions we can take it. But yeah, let them keep it in the chat.
Put in your chat box so that we have a track of it, and you don't forget your questions. Yeah.
Correct. Great. So I hope you're able to see the screen.
Yes.
Is the screen visible?
Yes.
Great. I'll just move forward. So, all right. So, introduction to genetics, the blueprint of our life. As Fatima said, she's given an example that every individual is unique, right? We have different genetic material, what we carry from our parents, basically. And a lot of times we do practice, right? When we take our recall in terms of, okay, this could be the factor, stress could be the factor, lifestyle could be the hack factor. But we often say, right, that probably you're carrying it carrying it from your genes from your parents, and there is a risk factor for you also getting diabetes, or you also getting a particular any kind of a heart disease or any kind of a deficiency, basically. So what was that? Initially it was not clear, but now a lot of research has been done, a lot of research is going, and that's how the entire interaction of nutrition with the genes is what we called as nutrigenomics, basically. And this is going to be the future of the science. Obviously with the ancient basic knowledge what we have about calorie deficit, calorie surplus, certain foods restrictions, certain food fads which we follow specifically. But how does nutrigenomics stand into precision nutrition? Because it helps you to understand the underlying causes. It helps you to understand at cellular level how the metabolism is happening, and how you can apply it to your day-to-day life in terms of your detoxification levels, your supplementations, your stress management, in terms of also knowing your pharmacogenomics, in terms of like which drug will work better in this person if somebody has an a particular kind of a lifestyle or a disorder specifically. So that's where it is important to learn about nutrigenomics in today's day, its testing and its application. So I'll start with the basic structure about understanding what is the core basically about the genes, what we talk about. So we have a DNA, which is called as the master plan specifically. So it's like a hardware of our body specifically. So it is like a double strand. If you see in the picture, like, it's the double strand which is there. So basically DNA stands for your nothing else but deoxyribonucleic acid specifically, which, so its main function is to help in reproduction, help in growth, help in cellular functioning, the signaling and everything. So it's basically the complete hardware of it. Now, this is made up of smaller particles, which includes your phosphate, which includes your nucleotides. So now what are these nucleotides is basically your adenine, your thymine, your guanine, and your cysteine. So basically, these are the nucleotides, specifically the main nitrogen bases of your DNA. And what happens is when these nucleotides, there's a sequence. Now, when these nucleotides are paired in a particular sequence, you have the gene expression basically. And that, I mean, there are specific segments which decodes your particular carry of the information which we say, and when they are brought together, they become as a genes, they become as a functional units which we call as genes, basically. Now these genes is basically what defines a physical trial of an individual, whether it is a color, whether it is a height, whether it is in terms of the risk factors, or the internal mechanism or the conversion factors. Like, a simple example I can give you is a conversion of folic acid to folate, basically. So there is a certain gene which we call as HFR, which helps in this conversion of folic to folate, which is nothing else but an inactive form to an active form, basically. And then folate is responsible for your methylation process, which is also connected to your heart-related diseases, your CRP. So if you see a very high inflammation, so probably a CRP test is done and we understand, but it plays a very important role. Same way, RNA. Now, RNA is a single strand molecule. Basically, it's ribonucleic acid, which we call as. Now, this is a software of your body. It is like as simple as in a computer, we have a hardware, we have a software. Same way in a body, DNA becomes as a hardware, RNA becomes as a software. Software which does the work of signaling, the carrier, basically, specifically. Your DNA will have the master plan, so it has the blueprint कि ये ऐसा ऐसा होगा, this is the structure, this is the design, this is how it is. But उसको execute करने के लिए, like in simple terms, उसको execute करने के लिए, the entire blueprint which is there, the RNA does the work. Now, this RNA, they are of major types. We will not go into detailing about each type because I said this is just a workshop to understand about the basics, and then we go into the detailing when we do the course, basically. So there are three main types, which is the mRNA, tRNA, rRNA again. So these are the facilitators of all your protein synthesis. And this decodes all the functional proteins in your body and the signaling and the carrier path and everything. All right, clear till now? To understand the basic structure of how does the DNA works, I mean, the basic structure of genes. Now we'll just understand that, what are the nutrition impact on the gene expression. Now we all know that nutrients are just not the fuel. They are also the powerful signals which can directly influence how your genes behave, impacting your health and diseases. I'll give you a quick example because it's very complex to understand this. So I'll just give you a very brief example of, let's take an example of vitamin D. We all know that vitamin D is known for its massively for your bone health and for your obesity factors, your inflammation, your immune. I mean, a lot of vitamin D is associated with all these things. We'll not get into the common things which we know. So we'll understand that why, like, how does it have an impact on your gene expression, which we also term as epigenetics, So now can anybody quickly unmute and let me know what do you mean by epigenetics? How it is different from nutrigenomics? I mean, are these two words same or they are different? If anybody can just unmute and let me know what is epigenetics. Does anybody know what is epigenetics? Okay, I'll just give you a quick one-liner in a simple term. Like you have the hardware में software रहता है. You can change the software, right? आप hardware change नहीं कर सकते हो, but आप जो software डालते हो उसमें वो आप change कर सकते हो, right? Same way, the study of this change, कि how does a particular nutrient can alter your gene expression. The study of that is called as epigenetics. So there are certain ways where supplementing certain nutrients, when you understand in the test that, whether if it is deficient, what are the risk factors, and supplementing a certain nutrient can help you to basically work with your lifestyle disorders, whether it is inflammation, whether it is related to cancers or Alzheimer's, or a lot of diseases which are related to it specifically. So I'll just give you a simple example, like how, like with vitamin D. So the active form of vitamin D, basically, it binds to a particular receptor in cells, which we called as vitamin D receptor, which we call as VDR specifically. Now this travels to DNA and can directly express and influence the gene expression. So say, for example, to simply put it in terms of example is if a particular female has got it tested for a low vitamin D levels. So supplementing a vitamin D into an act. Now, how do we will normally, how we will do the approaches, we will do the test, deficiency rahega, we will give them the supplement. Now, why nutrigenomic, or how nutrigenomic is different from the other regular approaches? Now, when you do a DNA testing, you understand that what form of vitamin D needs to be given to that particular body. And that's how you understand whether the active form, the non-active form has to be given in terms of a certain conditions to treat that level, which is based. So this is how the nutrigenomics stands for your precision nutrition. Same way for your folate. Now the conversion of folic acid to folate, there is a regulation of a gene, right, which I told specifically. And we all know that folate is associated with a lot of, which supports your signaling, your activation, deactivation. So when you do a DNA test specifically, you understand whether a person needs a folic acid supplement or whether the person needs a folate. So folate is basically adding a methyl group to it, and it becomes the active form, which is more powerful and which is more, I would say, like, it would go more better results to a client, because the conversion is not happening because of the gene, the genetic, whether it is underactive or overactive. Depending on that, you can actually decide whether a person would have a folate supplement or a folic acid supplement. I think which will be taken care in the further workshop also. I'm just giving a brief about it. Same way in omega-3. We all know omega-3 fatty acid is known for its anti-inflammatory properties. So what does supplementing, though a specifically person who has a lot of high CRP levels, or who come with a lot of skin diseases, where usually the basic cause is, one of the cause I would say is inflammation. So we randomly give omega-3 supplements. Now, why we do that specifically? So basically it helps to alter the cycle. It also contributes to a methylation cycle again. And I told you methylation cycle is again associated with your inflammation also. So what does omega-3 supplement does is it helps in your gene expression, and it will give signaling to certain kind of pro-inflammatory cytokines in your body, which will help you to reduce your inflammation. Now, how do we know whether we are supposed to give omega-3 supplements and how much we are supposed to give omega-3? Is the DNA test, the nutrigenomic test, which actually helps us to understand more deeper. And again, this helps us to understand why we need to understand nutrigenomics and, practice this precision nutrition. All right. Going further, a brief overview about how the healthcare is now going to, revolve around. I think in sports, this is very common. All the topmost sports. If you see Djokovic, whether I mean, which was there. If you, I don't know if you know, any of y'all know Rian Fernando, speaks a lot about this DNA testing into the sports world specifically, because it again helps you to understand uh, about your disease susceptibility, your pharmacogenomics, again the drugs which you need to be taken specifically. Also, it helps you to understand, whether which type of diet a particular person will benefit from, or will have a 98% of success rate in their transformation journey. Same way, whether a person is gluten intolerant, caffeine intolerant, what is its sensitivity toward the cell. When it comes to obesity panels, I mean, we have different panels which we'll understand a little bit more in detail later. So when there are obesity panels, you also have, like, is inflammation the main factor for obesity, or is it the lifestyle, or is it the stress factor, which is the, so you get to know about when you do a genetic testing, or when you know how to apply nutrigenomics. So you'll be able to have a tailored, more precision and more personalized nutrition in all these areas specifically. So this was just brief about what is nutrigenomics, what is genes, what is DNA, what is RNA, how a particular nutrient can impact on gene expression, and we can definitely help them cure a lot of diseases, or at least those who are from risk factor, they can work in preventive care instead of, and it can save a lot of money also. Like, I think a simple DNA test can be, it is 35-40,000. But if it is really helping a client who already has a family history of strong diabetes or heart health, and you're going to spend lakhs of money later, can definitely investment of 40-45,000 at one go can definitely help. And it's a one-time test, if I'm not wrong. I give it to a lot of my clients. It's a one-time test, and it really works wonders how the personalized precision nutrition goes. There is also clock gene which is involved, which also in fact tells you the time of what kind your particular metabolism is active specifically. So it can also help you to understand that also. So that's how beautiful the entire study of nutrigenomics and its application is wonderful when it comes to precision nutrition. Yeah. You can just put in your questions, guys. I've just taken an overview and started with an overview about it. And yes, Fatima, I can just take it ahead for the next session.
Thank you, Ankita, for creating a base for us to discuss ahead. So, our next session, like I told, it's about genetic disorders. Yeah. So, a quick question to everyone. Are inborn error of metabolism and rare genetic disorders same, or they are different? Because we are going to discuss both of them. So you need to have some basic about both of them, what are, whether they are same or different. So quick yes or no from the audience. If you don't want to unmute your speaker, just type in your chat box. If it is same, then type it yes, or if it is different, then type it no. If you don't know, then it's okay. You can say I don't know. No. Okay.
Yeah, Anita and Ujjwal, they say no. Sunita also says no. They are not same.
They are not same.
Interesting.
Okay. Any more answers? Anyone who says yes? Okay. So basically, these are not same, but they come under one umbrella. They come under one umbrella of genetic disorders, because inborn error of metabolism are also caused due to genetic mutation or genetic disorders or any issue with the genes, like your rare genetic disorder. But the basic, what makes them different is the symptoms and the way they execute. The inborn errors mainly exhibits in the form of deficiency in the enzymes, in the genes of mutation in the genes of enzymes which play role in the metabolism, whereas other rare genetic disorders have mutation in other, which shows the sign and symptom in the physiological disorders or the neurological disorders. So the Exhibition of the mutation is different, but they come under one umbrella of genetic disorder. So I hope that's clear to everyone, because this basic difference you should know before we can start ahead, because both the topics may look like same, but they have a small difference. If yes, then I can see some thumbs up if you have understood the basic difference. Okay. Yeah. So we'll start here about what is an inborn error of metabolism. So it's a heterogeneous group of disorders which inherit or may occur because of the result of spontaneous mutation. Now this can happen that inborn error can come inherit via from the parents, or wherein the parents may be recessive genes, they may be not the dominant one, but it can show as a dominant gene in the child, or it could be the result of spontaneous mutation which may be shown in the later stage of life. But these diseases involve the failure of metabolic pathways. Now we have studied different pathways in biochemistry, right? Pathways for carbohydrate metabolism, fatty acid metabolism, and protein metabolism. So अभी के लिए वो सब जो भी आपने cycles पढ़े होंगे वो सब याद करो, right? So they were very complex. Agree? And because of this complexity, there are many enzymes which play role in making that cycle to work. There are many enzymes which convert one substrate to another form, and because of these enzymes play a very crucial role. If there are any genetic mutation in the genes which are making this enzyme, then you may see these errors. Although these are very rare, it's like 1 in 25,000 births, so it makes it very common also, but very uncommon. But now, because of many mutations seen because of lifestyle, because of the pollutants and environmental factors, you may see these conditions very frequent. This can be present at any age, so you should have a working knowledge about this disease, but most of the cases are seen in the early stage of life. So how we can detect? So mainly newborn screening programs are there for this testing. So today in workshop, I am not going to cover about newborn screening or genetic testing and analysis, which are done for the different form of inborn errors, because it may take too much time. We may cover it in a course, but today you will get a gist about all the type of inborn errors and what exactly happens in our body. But now here the question is, why nutrition matters? Do you think it matters to give a proper nutrition? Yes or no? Zara says yes. Okay, it was yes for the earlier. Okay. Yes, nutrition matters because in these errors we are dealing with the macronutrients which are present in each and everyone's diet. It's a normal staple diet what we take. So all your carbohydrate, fatty acid and proteins. हम fats रोज खाते हैं, carbs रोज खाते हैं, protein रोज खाते हैं. So nutrition here plays a major role for the treating and curing the patient. Nutrigenomics, we talk about prevention, but here we are helping the patient to have a better life and prevent these complications because of this gene mutation. So here are few inborn errors mentioned here. So these are categorized by the macronutrient what they are affecting. So first we have carbohydrate metabolism, wherein you have galactosemia, glycogen storage disorders, and hereditary fructose intolerance. Now in fructose intolerance you have two, which is because of the body metabolism. The person is intolerant to fructose, but there are few fructose intolerance wherein there is a gene mutation and it results in fructose intolerance. So we'll take it one by one. Now, if the person has any of these three disorders, the symptoms may be seen as jaundice, hepatomegaly, and hypoglycemia. So the newborn child who has been detected with any of the carbohydrate metabolism will show a case of jaundice, wherein the liver profile will be deranged. There will be hepatomegaly, depending on the severity, how it has affected the child, and persistent hypoglycemia. Even if you are feeding the child, the child will be having hypoglycemia. Can anyone tell me why they can hypoglycemia is so common in these kids? So we are not giving any marks. So even if you're wrong, you can answer, not a problem. But we just want to know what is your basic understanding about biochemistry, because इसमें biochemistry and cycle सारे role play करते हैं. And I don't want to make this boring.
Because the complex carbohydrates are not broken down into glucose in these cases.
Okay. Yes. Zara, I had asked the question why hypoglycemia is more common in the kids who have carbohydrate metabolism error. So like Anita told, because glucose is not properly utilized and processed in these kind of kids. So when we talk about galactosemia, it is a condition wherein the person is intolerant or cannot process lactose and galactose from the milk. And it cannot convert this galactose to glucose, because of which there is too much of accumulation of galactose in the liver. And because of that, there is a liver damage. And the enzyme that is GALT, G-A-L-T, glucose 1-phosphatase uridyl transferase, is the one enzyme which is defaulted because of the mutation, right? So in these cases, basic treatment like just avoiding milk could be the thing which can cure off. So that's a simple nutrition therapy we can give. But again, wherein you have to check in whether Ankita, you have raised the hand.
Yeah, so that's what Fatima was just trying to tell them. I mean, just because you gave a very clear-cut example of lactose and the conversion. So I think the test again, like, why nutrigenomics, understanding. So a simple test of understanding whether a person is lactose intolerant or not, based on that is how this is decided, and you can have the nutrition therapy. So I just wanted to just connect the dots.
Yeah, thank you so much. So likewise, testing plays an important role here again. And second, we have glycogen storage disorders. So here there are many type of disorders, like there are 9 types depending on which enzyme there is a mutation occurring, which genes mutation is occurring, and which enzyme is affected. So basic thing is like problem comes here, your glycogen is not converted to glucose. And because of this, there is too much of glycogen storage in liver and muscles, which causes hepatomegaly, again, damage to the liver, and muscle weakness happens. So here, their nutrition therapy plays the major role, and I think this is one condition, glycogen storage condition, wherein you have to be very precise about how much glucose should be given, how much complex carbs should be given. Even you have a therapy that is uncooked starch therapy to be given. So how much uncooked starch to be given is need to be decided individually, and it should be calculated as per the condition. So here planning plays a major role, which we can learn in detail when we do all the 9 disorders in detail, because each disorder has different type of management. But overall in this carbohydrate metabolism, it's like glycogen is not converted into glucose and people can't use it. So even if you are eating well, you are into hypoglycemia. So here complex carb which give a slow release of glucose is important, and uncooked starch and frequent feeding is important. Then we have hereditary fructose intolerance. Here again genetic testing is important to know whether the person is fructose tolerant or no. So again your testing genomics plays a role, and then likewise we can give a therapy. But here basically, as name suggests, person is intolerant to fructose, and all the food which are rich in fructose need to be avoided. So what are the foods which are rich in fructose? What do you think we should avoid here? That's a very basic question, I think. What are the foods which are high in fructose need to be avoided?
All are major fruits.
Food. So your fruits, fruit juices. But here again, along with fructose, sucrose need to be avoided, because again it is the same condition going on. Your enzymes called aldolase B enzyme, which converts both of them, fructose and sucrose, is deficient, is mutated, and because of that both need to be avoided. So there are the long list of things which need to be avoided because of this condition. Are we clear for the carbohydrate metabolism? Any question you can put in the box. Likewise, testing is important again. So when we do a course, we will look into what testing we need to do, how to interpret the testing, and how we can design a basic personalized diet plan depending on the testing and the symptoms for the person. Protein and amino acid metabolism, PKU. Can anyone tell me the full form of PKU? Because it's very common. Everyone must be knowing it. And I think we have done in our degree colleges. So I won't take in much time to explain PKU. Girls, those who have cleared just now, I think very simple question.
Phenylketonuria.
Yeah, very good. And what is the this amino acid which is affected, and can you explain something in detail if you remember?
In this condition, the phenylalanine is not converted into tyrosine,
Yes.
which should have been broken down by the phenylalanine hydroxylase enzyme
Very
due
good.
to its deficiency.
Yeah, so we have learned this condition in our colleges. So we will cover that again. But along with that, what testing we need to do, we will cover in detail so that it helps you to treat the disease well. Then you have MSU, maple syrup urine disorder. So that has effect on metabolism of branch-chain amino acids like leucine, isoleucine, and valine, which gets accumulated in a cell, and it causes neurological defects, and it gives unusual urine odor. So you have urine odor of maple syrup. So that's a particular sign which tells it is a metabolism error of branch-chain amino acids. Then you have homocystinuria. Here, homocysteine is not able to convert it into cystathione. Then because of that, there is lot much of accumulation of homocysteine, which creates problem. And if homocysteine level are high in a body, then it can irritate your endothelial lining. It can damage your collagen in the skeletal muscles, resulting in weakening of bone. So again, testing here plays a major role. Also, there are few genes testing like MTHFR mutation genes. So that is also again related with homocystinuria. So we will learn about that also in detail later on. But just remember here, homocysteine is not converted into cystathione. In fat metabolism, there are three deficiency. MCAD, that's medium chain acyl choline dehydrogenase deficiency, and LCH, that is long chain hydroacyl dehydrogenase deficiency. In these both deficiencies, your fat chains, fatty acid chains are not broken down, and it gets accumulated in your body and not used up properly. So again, the what kind of diet should be given, it needs to be given decided depending on the what kind of deficiency it is. I hope basic introduction is clear. Now, what are the three consideration should be done when we are managing this diagnosis? Like, first, individualized approach is needed. Your testing must be done for the genetic testing, your lab testing, considering the physical and the clinical symptoms what the person is showing. You can decide on what genetic testing needs to be done, and your lab testing must be done. Then, avoiding the offering nutrient. Now, considering the condition, for example, when we talked about phenylketonuria, so avoiding all the protein rich food which has phenylalanine in highest amount needs to be avoided so that the person can have a better outcome. Also, giving low protein diet works well here in all your protein metabolism, but to replenish the protein, giving them a specific supplements which has low amount of phenylalanine in PKU, then low amount of branching amino acid in MSUD. So that needs to be decided, and that supplements to be added so that they can meet up their protein requirement. So that's a second point, using a specialized modified medical foods. So your supplementation plays a role here, but again, depending on the test reports, what supplements need to be given should be decided. The key consideration we need to do while planning for these conditions are to prevent catabolism. We don't want our patient to go under catabolism, lose weight, and go malnourished. So our first motto is to how we can feed them and give them proper nutrition is the thing. Monitoring growth and biochemical markers is the most important thing here. So regular testing, regular keeping the assessment of the growth is important. These conditions are special, so educating family and caregivers is important, wherein you need to teach the person who is cooking food for the person. Like if it's a child, we need to teach the mother. If it's a husband, then we need to teach wife what needs to be cooked, how it needs to be cooked. The special education for the family is important. That needs to be done. And these condition needs ongoing adjustment. Like you may have a sick day regime to be followed. When the person is sick, then how we can manage them, because when the person are sick, the management differs. So all these need to be learned, and these need to be addressed to the patient and the caregiver and the family members. So here again, if we go deep dive how we can do this for each and every condition, it may take lots of time. But today, my motto was just to give you a brief about all the inborn errors and what specific nutrient needs to be avoided in each inborn error, but how to manage the other nutrient. Like if we say low protein देना है, तो अगर हम low protein देते हैं because of phenylalanine low करने की वजह से, then we are not able to meet up the protein. Then how we can meet up the protein? We need to think on that. We need to work out for that. So again, deep planning and learning about deep planning is important. So that was my way of giving you a gist of it. But if you have any questions or query about any inborn errors, if you need any more explanation, we can take it up later. Yeah. So I would hand over to Ritika for the further. Ritika, do you want to share the slides or I should share?
It's better that you can share because I'm not able to download it properly. I mean, there's a signal issue here. So,
No
but
problem.
am I audible? Am I audible? Is my screen? I mean, is everything okay?
Yes, you're audible. So I would hand over to Ritika for the further.
Okay. So, what do you all think when it comes to nutrition and rare genetic disorders? Do dietitians play a significant role in this kind of a situation? Can anybody tell me? It's a yes or a no. It's okay. Okay, definitely yes. We dietitians play a major role, one of the major role in the interdisciplinary team in managing the rare genetic disorders. So you have the chromosomal disorder, you have the neuromuscular and the lysosomal disorders. These are some of the genetic disorders that have been seen in these individuals. But I am going to take some of the disorders here where I'm focusing, and later on when we are doing the course, I will be giving the details about how to manage these disorders, what are the dietary recommendations to be given, because it's a extremely vast chapter. That's why. So you can change the slide. So introducing, when coming to the introduction, it is the rare genetic disorder. It is a group of medical condition which affects only the smaller portion of the population. And it mainly occurs due to the mutations of one or more of the genes. Okay, so these disorders are mainly diagnosed in the childhood, and it can have a significant impact on overall health and development, the growth and the development, and overall the nutrition status of the individual. So it occurs, the overall genetic disorders, the rare ones, it will affect in fewer number of the population, especially the United States. So mostly in the Western countries, the rare genetic disorders is mostly seen because of proper diagnosis and implementation and interventions are carried out beautifully over there. Whereas in India, due to the larger population, the diagnoses are not properly carried out. So we do not have the exact data of it. So there is fewer than 200,000 overall, the rare genetic disorders are available. So yes, nutrition care plays a very significant role, because from the childhood till the adulthood, every nutrition genetic disorder has major nutrition complications. So the nutritional management plays a critical role over here in maintaining the growth, the development, and maintaining the overall energy balance of the individual, including the metabolism. So it should be tailored also properly. So because every disorders, they have complications also. So dietitians also need to do a personalized plan for this kind of individuals. And mainly in main genetic disorders, you get malnutrition, and obesity also is one of the main reasons, because of the imbalance of the nutrients. So next slide, please. So these are some of the genetic disorders that I have jotted down here. So first we will go through is Down syndrome. First one is a Down syndrome. It is also called as a trisomy 21. So main cause is the trisomy 21, because totally we have 46 number of chromosome in the 46 number of chromosome, but in the 21st region, instead of having the 2 chromosomes, there are the 3 chromosomes. So henceforth, it is called as a trisomy. Other than that, we have the mosaic model, where the similar trisomy 21 pattern takes place, but not in all the cells, but in the in the different parts of the cells. So not all the cells, but some one cell, then some other cell will also take place the same trisomy part. And then one is a translocation, where the one part of the chromosome 21 is detached, and then it attached to some other chromosome. So this is how the Down syndrome takes place, and this is how the genetic manifestation takes place. And the clinical features, it causes intellectual disabilities, hypotonia. Hypotonia is major in children with Down syndrome. What happens is, due to their facial features, one of the major facial features is they have a small lip and a small buccal cavity. So because of which, it is the tongue appears to be large. So when the child tries to suckle, or when the child tries to eat the food, the child won't be able to swallow the food nor chew the food properly. Sometimes the child chokes also. So that is one of the major things. You find it, hypotonia is one of the main things that you see in children with Down syndrome. And apart from that, you have the heart disease, short stature, is major cardiac issues also is available. Obesity is also one of the major nutritional problems that is found in individuals with Down syndrome, once they go to the adulthood. So another one that I'm coming to is ADHD. It involves the dopamine and norepinephrine imbalance also. So it is characterized by inattention, impulsivity, and hyperactivity. So these children are more of hyperactive individuals. So there is the child cannot pay attention properly. There is difficulty in paying attention. There's so much of impulsivity. The child cannot sit in one place, and lot of hyperactivity. And at times the child, what they do is they do not understand the conversation of in one another. So they try to stop the conversation. They don't have the patience to listen to the conversation. So that is one of the scenarios that I can tell about. And the causes of that ADHD is not actually known. So it is a combination of genetic and environmental factors. So some say it's genetic, but there may be researches that is going on where it could be brain injury, it could be the family, how the family environment is. So this is one of the main reasons that ADHD can happen, but exactly we don't know why it happens. And it is a neurodevelopmental disorder also. So there is no proper focus in such children. So next disorder, like I try to focus, is the mitochondrial encephalopathy lactic acidosis stroke-like episodes. So in this kind of situation, in this kind of individual, they typically, what happens here is there will be buildup of lactic acid. So because of the carbohydrate once a carbohydrate breakdown takes place, it produces lactic acid. So there is too much of accumulation of the lactic acid. So that what happens is it gives us stroke-like symptoms. So here there is muscle weakness, seizures, and there's slurred speech, and there's loss of vision, fatigue. People who has MELAS also, like, they have too much of fatigue also over here. So yeah, and it affects in 1 in 4,000 people and can affect anybody. But women are the ones who are carriers, and they're the ones like who can pass it on to the next generation. So that is about the MELAS, and it occurs anywhere between 4 years to 20 years, 40 years of age, but it cannot be detected earlier than that. It is pretty difficult to get it at that point of time. Yeah, and then we have the Gaucher syndrome. It is a genetic disorder where there will be a deficiency of cerebrosidase that is responsible for the metabolism. So the cerebrosidase, what happens is it cannot properly break down the glucocerebrosidase cannot be properly broken down into cerebroside. So what happens is there will be an accumulation of that non-processed glucocerebrosidase, which is called as a Gaucher cells, and they will be accumulated in the liver, the spleen, the bone marrow. So because of that, what happens is there will be enlarged liver, spleen, and bone marrow. So what happens is there is hepatomegaly, splenomegaly that takes place. And do you know like what happens if there is a hepatomegaly, splenomegaly? What is the major nutrient deficiency, or what is the problem that occurs in such individuals? Can like anyone tell me? What nutrient and what a problem happens in such individuals who will have splenomegaly, hepatomegaly? So anemia will be the major issue in people who are having Gaucher syndrome, because there will be no proper the iron, there will be no proper utilization of iron and production of iron, and storage of iron also like will be really impaired in the people and children with the Gaucher syndrome, and and there'll be a lot of bone fractures also in such individuals. And because what happens is when there is enlargement of spleen and liver, there'll be compression towards the stomach also. There'll be early satiety present in such individuals. So, and the Gaucher syndrome is the more common lysosomal disorders among all the lysosomal disorders that is present here. Can I have the next slide, please? So, in all the genetic disorders, the most common nutrition challenges, especially in children and adults, is the hypotonia, oromotor dysfunction, or neurological delay. These are mainly present in the children. So hypotonia is there is loss of muscle tonicity, so the child won't be able to chew the food or swallow the food, and in fact the muscles also tends to be very weak. The milestone development will be extremely delayed, and the dietitian, the speech and language pathologist, and the occupational therapist combined should come together, and we have to be a part of the part of the intervention for the proper quality of life of the child. And they are susceptible to nutrient deficiencies also, like vitamin B complex, calcium deficiencies also, because if there is there's a oral motor dysfunction or this hypotonia, what happens is that there's no proper intake of nutrients. So they are the most probably susceptible to such deficiency. And the behavioral issues are a lot of them in cases like ADHD and single chromosomal disorders also, because like they cannot sit in one place, and they have too much, there's too much of sensory issues also over here. So they're hypersensitive, they're hyperactive also. So they're very, they have too much of picky eaters also. And there's a lot of pocketing also, like when they're eating the food. So they'll be either hypersensitive or they're hypersensitive in such individuals. So the nutrition therapy that we can offer here is to be customized, as I said before, and we have to support the growth, the immunity, the muscle strength, and bone strength also. Like for For hypotonia, also, like for example, there are specific cups and spoons and glasses also, like for the individuals who are having feeding difficulties and swallowing issues and all. And at times, like we have to use supplements or tube feeding also in severe cases, because hypotonia in certain children, it is like for shorter duration of time, but as they come to adolescence and adolescent stage or maybe early childhood, the hypotonia tends to be wear off. So, and we have to educate, and counseling also is really, really important in this case. Anybody has any doubts? So, as nutritionist, like we have to be updated with the knowledge and the science backed up information on the, and these nutrition disorders also, they're pretty rare, so we have to be updated every now and then. And holistically, like we have to plan the interventions for these individuals with the help of the multidisciplinary team, and we have to raise awareness also. It is not optional at all, but it is very necessary. So we dietitians play a major role in this rare genetic disorders. But like as I said, from the childhood to the adulthood, they will have a lot of nutritional issues and lot of complications. So we as dietitians should be with the other teams in order to improve the quality life of the individual. Thank you. Any doubts, clarifications?
So guys, if you have any doubt, you can put it in your chat box. Yeah. So here, I think Ritika has tried to cover few of the diseases, right? There are a lot many rare genetic disorders which are very common. Ritika?
Yes.
There are other diagnosis, genetic disorders also, na, which are very common. You have tried to cover few of them, right?
Yes,
Today.
yes, few, but there are many of them, because we have categorized the various genetic disorders also. So if like anybody would be interested in joining the course, like definitely we'll be covering with this, and we will have a detailed like structure and interventions and all, what and all we'll be telling, and what the testing and all is done for these genetic disorders. We'll be letting you know.
Deblina, you have a question?
Yes. So,
Deblina, mute your mic for the laptop.
is it proper now? Still echoing, just 1 minute. Yeah, I think it is better now. So, as Ritika said rightly, that regarding the ADHD, attention deficit hyperactive disorder. So, these patients typically, when come to the clinic, what happens? Being a dietitian, being a nutrigenomic dietitian, at first sight only, you guys will be confident to cater these children, because see, the first symptom what they came for, or what their parents are most worried for, or their pediatrician are most worried for, is their hyperactiveness. Now we know a child at a age of 5 to 7 years probably be needing 1200 to 1300 calories. Now we cannot afford to give that child 1800 or 1900 calories just because the activity level is higher. But ideally we should give. Now think, if we don't know which kind of diet I need to cater to this child to maintain his like daily calorie expenditure, that is how we calculate our total calorie intake, right? Their activity level is very high, very high. Their metabolism also works like that. So, being a dietitian, we need to think in two ways, that we need to work on the epigenomic effect to improve their symptoms, their speech disability, their eyesight contact, their cognitive function improvement, as well as their
meeting up their total calorie intake. Also, ADHD, autism, epilepsy, dementia, these categories of people, they come with a typical gut microflora, which I will be covering later on, that also needs to be catered. So every genetic disorder, every rare genetic disorder comes with a typical microflora pattern and a typical symptom which can only be catered through and through diet. So medications are there, but medications will put a very less effect when it is related to your genetic disorder, because that is already present in your gene. We need to do polymorphism. We need to do polymorphism from outside, right? So this is how nutrition is linked so much in rare genetic disorders. So linking the things.
Thank you, Deblina.
Thank
So
you.
at the end, yeah, Ritika, you were saying something.
No, just thanking Deblina.
Acha. Yeah. So at the end, I think everything is interlinked. Your gut flora, your genetic disorders, your nutrition, and their clinical symptoms all are linked together. And if we try to improve one aspect of nutrition, then all things can come into place. So for catering that, we need to know what exactly is wrong with that person, so that our DNA can help. DNA testing, genetic testing can help. गेस वर्क तो हम अभी भी करते हैं, जो ओल्ड मेथड है, दिस कुड बी द फैक्टर वी आर केटरिंग दिस, सिम्टोमेटिक रिलीफ करके कॉम्बिनेशन परम्यूटेशन हम अभी भी करते हैं इन आर डेली प्रैक्टिस. बट टू गेट दैट डायरेक्ट पॉइंट बैंग ऑन कि कहाँ हम उसको हिट करें, वो फटक से हमें रिजल्ट मिले, वी नीड टू डीप डाइव इनटू जेनेटिक्स, राइट? सो अ क्विक रियलिटी चेक, हाउ आर यू फाइंडिंग दिस वर्कशॉप? अगर अच्छा लग रहा है तो गिव अ थम्स अप, अगर नहीं लग रहा है तो thumbs down, guys, just to check whether you are there with us or not. Thank you so much for so many thumbs up. So we hope this gives you a good go back message to help your patient well. So we have another speaker, Tanveer Fatima. So do you want me to share your slide, or you will share?
I will share mine. I
Okay, great. And guys, remember at the end you have a quiz to play. So please listen carefully. All the questions are based on the talk what we are giving now. Thank you. Tanveer, do you need any help?
think it's not opening. Just a minute. Yeah. Now you're able to view my screen?
No.
No?
No.
Now?
No.
It's not coming.
You can share from the window panel. Window में जाके.
It's not coming. Fatima, I think we won't waste time. You share it. So I think some problem is there. I'm not able to share it from here.
Is it okay?
That's fine. So good evening again, everyone. So we are here to study about nutritional genomics now. So have you ever heard about evidence-based practice? Please tell me in your chat, yes or no. evidence-based practice. So we'll be learning about evidence-based practice in our course. Okay? Because we know about diseases, about lifestyle, about diet. With the help of nutrition and diet, nutrition and gene talk to each other. So we'll study about that and we'll get access to the root cause of the problem. So this is evidence-based practice. We'll be able to tell our clients, to serve our clients with evidence. So nutritional genomics is a big umbrella term, which is used for nutrigenomics and nutrigenetics. It focuses on how diet and genes interact. How do they talk to each other to influence our health? So we will study about nutrigenetics and nutrigenomics in our course. Next, please. So as you all can see, that why nutritional genomics is required. Nutritional genomics is a wider term. I told you about nutrigenomics and nutrigenetics. So nutrigenomics is basically we learn how are nutrients affecting gene expression. Whatever food we are taking, so particular nutrients, how is it affecting our gene expression? For example, when we advise haldi as a supplement for inflammation, do you advise curcumin as a supplement to your clients? So generally, what happens? We generally just prescribe them that take haldi as it is anti-inflammatory. So now we know through nutrigenomics that it just down-regulate your inflammatory genes. Okay, that is necrosis factor kappa B, and which offers proper health benefits, and inflammatory genes are down-regulated, through which your inflammation or CRP levels go down. So through nutritional genomics, we can just give precision nutrition to our clients for a particular problem. We can learn like why nutrient is affecting the gene expression. So one size fits all, we cannot go with this approach now. It's a up thing that we have to just take care of precision nutrition. We can help disease prevention, and we can improve performance our athletes as well. So it is in our nutrigenomics is in demand, because we can help athletes and problems, persons who are having genes of diabetes, cardiovascular diseases. We can check with genetic testing, and we can help them through science of nutrigenomics and nutrigenetics. Next, please. So how many of you take coffee to just keep yourself alert in the morning and proudly say that I take coffee and I'm not able to wake up after before taking a coffee? How many of you take coffee as the first thing in morning? Say yes or no. No, very good, very good. So we all are dietitians over here. So we don't take caffeine, but it depends. Someone can thrive on caffeine and someone cannot thrive on, because each and every individual metabolism of caffeine is different. Some are slow metabolizers, some are fast metabolizers. So there are particular genes in our body. It is about, so this is nutrigenetics. We are talking about nutrigenetics here. Like in our body, in our DNAs, we are having different genes which act according to the nutrient which you are taking. So nutrigenetics explores how individual genetic variations influence a person's unique response to specific nutrients. Like some people can metabolize coffee easily, some people are able to sleep well when they are taking coffee, multiple cups of coffee, and they don't have any problem of cardiovascular or heart attack sort of thing. But some people, it's not recommended to take. So how can we assess? We can assess through genetic testing of caffeine, that is CYP1A2 gene. Okay, so through this testing, we can just validate whether coffee suits one person or not. Okay, 50% of the population carries these variants, and that results in slow caffeine metabolism. So for these individuals who are slow metabolizer of caffeine, there is high risk of heart attacks due to prolonged exposure to caffeine's effect. Because for long time, caffeine is there. Caffeine is not metabolized by the body, and for long duration, it is there in the body. And because of which, heart attack risk increases. Yeah, next. So in our course, we will study about different types of gene mutations, different for lactose dehydrogenase genes are there, MTHFR gene is there. Anybody knows about MTHFR gene here? Which vitamin is linked with the MTHFR gene? Can anyone tell in the chat, please? Do you know which vitamin is linked with MTHFR?
Yeah.
Yes, Shruti said folate. Very
Yeah.
good.
I was expecting
Yeah.
Shruti would answer.
Yeah, Shruti is doing, I think, something from Nutrigenix itself. She's practicing. That's good thing, Shruti. Yeah. So MTHFR gene is linked with folic acid, and it is methylene tetrahydrofolate reductase. It's a gene which does methylation in your body, and it affects methylation. So it just whatever folic acid or folate we are taking, so it activates, this gene activates that form of folic acid, and through after that methylation occurs. And methylation is also very important part of our metabolism, as it is important for DNA repair. What is methylation? Do you know what is methylation? Methylation is addition of methyl group to your DNA or to your messenger to protein. So when a methyl group, that is CH3 group, is added in a certain compound, then methylation occurs. And this methylation is very important for our detox pathways, for DNA repair, for your mood regulation, that is serotonin and dopamine regulation, for balancing your homocysteine levels. This is very important. So methylation is affected with your lifestyle too. So when we are doing this nutrigenetic testing, then we are able to assess whether any lifestyle problem is hampering this mutation, is causing this mutation, particularly because methylation is very much required for our body. And when it is hampered through mutation in genes, then all disturbance or all diseases, different types of cancers, this type of things occur. Next, please. So we'll take an example of MTHFR gene mutation here. So we have taken here like Asara. She was 35-year-old woman, and she was diagnosed with MTHFR gene through her genetic testing. And she was carrying C677T homozygous variant. So we'll learn about different variants of genes over here in this course. So through genetic testing, genetic report reading, we'll be able to assess which type of gene is present and what problem it can cause. So this, because of MTHFR gene variant presence, this was causing her to get impaired folate metabolism. So because of that, her homocysteine levels were high. So MTHFR, as I told you about this gene, that this is methylene tetrahydrofolate reductase, and it is turned into its active form L-methylfolate, which is essential for numerous body functions, that is DNA repair and synthesis. So common variants are these type of genes. So this is going too much, a little deeper, not too much. I think it would be looking like it's too deep, but it's not like that. You will learn about different types of variants. You will have case studies and framework. You will have tools after doing this course. So you will be able to just plan a diet accordingly. Accordingly, you can just personalize the diet of Sarah. So how will you personalize diet of Sarah if she is having this variant of genes? So let's see in the next slide. Next slide, please. Fatma, next slide. Yeah.
Done.
Okay. So how we will go for her dietary and lifestyle recommendations? We have to avoid synthetic folic acid. Can anyone tell me why will we avoid synthetic folic acid in this case? Over the counter folic acid which is available, or fortified food products which are having folic acid. We will avoid it because when we are knowing that MTHFR gene variant is present, then we won't give her synthetic folic acid, but we will give active form of L-methyl folate, because we know that her metabolism is impaired. Yes, correct, Shruti. Folic acid to L-methyl folate conversion is impaired, and that's why we'll give direct active form of folic acid to her. So a daily dosage of 800 micrograms can be recommended for this enzymatic conversion. And other than that, we will include more folic acid rich products through green leafy vegetables, legumes, chickpeas and lentils, and liver, which will provide folate in its natural and more readily usable forms. And apart from that, we will increase cofactors, which are also required for conversion of this folic acid to active folate. So whatever diet we are giving, it will help, like vitamin B6, B12, okay, and methylcobalamin also will be given to just balance their this homocysteine metabolism and methylation pathways. And other than diet, we can recommend lifestyle modifications also, because stress also induces methylation depletion. So when we will incorporate practices like meditation or yoga to minimize stress, it can help with methylation processes. And regular exercise is recommended. We will recommend her to do consistent physical activity to further support metabolic health and methylation pathways. So guys, this is the future. This is the future of nutritional genomics, is the future, and we are already facing this. It's happening today. It's not a future anymore. So we need special scientists and we need special tools which are available now through nutrigenomics testing. And these tools will work wonders for dietitians. So I would recommend that you do this course, and you'll be able to support different athletes. Wellness centers and hospitals are requiring these specializations now. Okay, so I'll just hand over to Debelina for metagenomics. She will tell about metagenomics and our course. Thank you.
Thank you, Tanveer. So, students, myself, Deblina Chatterjee, I have a total of 15 years of experience and I am a certified nutrigenomic counselor. So, my topic is metagenomics. Fatima, if you can help me with the slides. Done.
Is it visible?
So, yes. So, see, till now, you have learned more or less about DNA, RNA, how genomics is affecting an individual's disease condition, how those disease condition can be modified with the diet, methylation, epigenomic effect, and now it is metagenomics. So in a nutshell, if I want to tell you all that when a person comes with a genetic defect, we address that person first with the DNA analysis. Now, DNA analysis always doesn't mean that I need to take some blood sample. Even the spit, saliva can work for the DNA sample. Though the test is a bit costlier in the first go, it is approx 25 to 30K. But then the complete kit, when I say a complete kit, that doesn't mean, see, there are n number of genes in a person's body, and it is like nearly very difficult to analyze all the genes, and there is no need. Actually, there are certain 20 to 25 sets of gene which are presently being studied in the nutrigenomic industry, on the basis of which diets are given. Now, the second step, we dietitians, we the nutrigenomic dietitians, get the dietary codes. For example, those who are working in the nutrigenomics field already must be well aware of the term FTO gene. FTO gene related with anybody? FTO gene.
Yeah, it is in fat metabolism.
Yes. So it is related with the fat metabolism, as well as, like, we generally check it for the obesity as well as the chances of occurrence of abdominal obesity, because once the abdominal obesity and visceral fat accumulate, the chances of getting your non-alcoholic fatty liver disease is very high. Okay. So I get certain genes, among which FTO, as I said, is one. ADHR. ADHR is the capacity of controlling the appetite. Okay, you now know, you can clinically also understand this person has come to my clinic for the weight loss diet. He is obese. I need to give him a diet for weight loss reduction. He will say himself only. But what tactics you have to keep in mind while planning the diet? So if my ADHR genes test comes positive, like the person have a issue in controlling the appetite, I have to give those foods more in his meals, which will help in controlling the appetite. For example, seeds, maybe some nuts, maybe a combination of seed and nuts, maybe a coffee latte in place of a black coffee. So customizing the things have made us clear in the nutrigenomics part. But what we do in the metagenomics? Every time a autistic child comes in my clinic, I cannot blindly prescribe, or the doctor cannot blindly prescribe Atkins or keto diet. Like doctor asked me, Deblina, give this Atkins, he writes in the prescription. So what doctor does? Doctors checks the history of the child as well as the parents. Next slide. So when I say history, it contains all these things. What? First, he checks the diet of the family. For example, the child has came from a Punjabi family. Now, Punjabis can drink a lot of milk. Bengalis take lot of milk byproduct. If you ask a Punjabi to have as much sweet as a Bengali have, the Punjabi cannot have. They will lose the appetite. They will lose this, that eating feeling, taste buds. But if you ask a Bengali to eat in place of 10 Roshogollas, maybe 200 or 250 ml of milk, most of the Bengalis won't be able to digest it. So here is the diet microbiome. According to the researchers so far, the Eastern population, like the Bengalis, have majority of beta galactosidase deficiency, due to which most of the Bengalis are either lactose malabsorbed or lactose intolerant. Whereas you break down the lactose and you give them the sweet, they would be happily eating it. But for a Punjabi, this is not the issue, because their diet, their dietary pattern, as Ankita was saying about the clock, right? So the timings of food also impact. That is also governed by 3 sets of gene. So all this genetic profiling first comes when you ask a patient to give a DNA test, and then the DNA test come, and the DNA test help us to understand what kind of meals we need to customize. Now, what does doctor does the second thing with the patient? The doctor understand the stool test, the stool culture. Every genetic disorder or a person who wants the diet to be or the medications to go genetic wise, or a doctor who does it like that, like I have worked with 2 3 doctors who does like that. They study the stool culture also, because the microbiome of every autistic child, microbiome of every ADHD child, microbiome of every Parkinson's disease patient is different, and that is why the stool is also different, and the cultures come different. Like for some, E. coli is more higher, for some the harmful bacteria are more higher. Now, being a dietitian, he will ask me to give diets and see the follow up results, and then maybe after 3 months we will do the tests again. Why 3 months? Because the life of a RBC is 90 days. So after 3 months only the blood tests will reveal the things, or the stool test will show us some visible changes. You will see most of the companies also sell their diet plans for 3 months. Why? Because to see any chemical change, biochemical change in the blood, we have to wait for 90 days. So this is the second thing. In the follow up, what generally you can expect? You can expect a change in behavior. What kind of change in behavior you can expect? You can see a ADHD child who was super hyperactive become a bit calmer. Maybe the eyesight movement has improved. Maybe the speech disability have improved. Because what is happening? The mutation is happening. The epigenomic effect is happening. The DNA sequencing is changing with the diet. And as Tanvi just said, stress also plays a vital role. For this category of people, when we are dealing with the genetic diet, we need to empathize the patient, because this is not a weight loss diet which we will get result in 15 days or a month or a 2 month. We are working on the DNA. We are working on the DNA methylation. We are adding the methyl groups to the DNA. We are doing the polymorphism, controlled polymorphism from outside. So it will take time, and that is why being a dietitian, we should know how to empathize, especially with the parents of these ADHD patients, autistic patients, mild, modest, because mild and modest autistic children have a lot of recovery rate, completely recovered. I have a lot of cases which have recovered. The last, fecal microbiota transplantation and future research. Now, this is the last fecal microbiota transplantation we do in very rare cases when there is really need. So I have got 2 such cases. It was from the family of Goenkas. I was in their project once for this patients. So it was their FTO gene, ADHD gene, MTFR gene, these were not in a proper line, like their sequencing was not good as per the DNA reports which we got. So the chances of getting diabetes was very higher. The DNA test was done when the person's age was only 28, but the report clearly stated this person is have a high chance of getting type 2 diabetes with a high probability of getting MODY in coming future associated with other chronic condition. Also, the DNA report revealed this person has a very high chance of getting a high fat around the waistline. So now, at this early stage, we knew about the person because they were like in the families. So they did this for future, like further tests and further transplantation. But for a regular family also, you can guide that, see sir, you have chances of diabetes, so I will suggest you, if you can buy a glucometer maybe, and you can do a test maybe once in fortnight and check your blood sugar random, and if it comes above the range, then you can take a fasting and pp sugar, and then you can uh, if the it goes beyond the range, I am always there, you can give me a call and we can work on it. So this is how the doctor will guide the dietitian. But then, being a dietitian, you should be in a position to understand, because doctor will not explain us around. Like how my doctor says to me, he just write in prescription in his short forms, and I just read it and I understand it. Okay, I have to do this, and I have to keep a track of that patient for the follow up. Because in autism, what happens, we give the Atkins diet. When we give Atkins diet, it is a high percentage of fat, so the main source of calorie is ketones, and then I have to ask the patient to do a ketone test also in stage 3 of Atkins diet, or maybe a modified keto diet. So there are different therapies. Next slide. Now, when these 4 things are done, I have given the first diet. Now I have to keep my patient with myself. Now, how I will keep the patient with myself? As I said, this is a place where you will not get the results immediately. You have to make your patient understand, make the patient family understand, sir, we are working on the genes and I am trying to modify it. So modification happens, oh, it takes time. It doesn't happen overnight, it takes time. So first, you will ask your patient to start having meals which are based according to his genetic requirement. As the DNA report says, based on that, even the DNA report gives also, as I said, clock gene. So there are person, most of you here, if I will ask you, may feel active during the morning, and most of you may feel active in the night. Like if you ask me, I am more active in the later part of the day rather than in the first part of the day. So I have not done my genetic analysis. Probably I am a night person. So if anybody gives me the regular pattern of a heavier breakfast, it becomes difficult for me to break down that heavier breakfast. But I feel more cravings during the evening times or maybe in the night times. So modification of diet definitely will be there, but doesn't mean I will like completely haywire, like I will opposite the clock and I will give heavier dinner and then midnight snack heavier one. I will try to cater a quality nutrition, definitely meeting the BMR rate, but then I have to continuously counsel the patient, sir, this is the thing you have to do, because this is going to change your microbiota of the gut, this is going to change your microflora. And as we know, in our country we cannot follow in a stretch more than 45 days a keto diet or a Atkins diet. We have to shift to either intermittent fasting diet or a hypocaloric diet or a paleo diet. So then for that time also I need to counsel them, okay, for this time we will be doing this things, and after this, after 45 days, then we will be restricting the window of VT. So which diet you need to follow, as you can see guys, that also depends on your genetic structure. There are n number of diets today in the market, but which is actually suited for you. So even if you want to go into academics, if you are teaching your students, then you have to guide that until and unless we know the genetic profile of that person. Now knowing genetic profile is also not enough. As I said, my doctor always check the cultural background, the eating background, the food timing background, fecal microbiota, that is also very important. Based on that, the strength of the diet, like how much fat percentage can be increased, how much can be protein adjusted, what amino acids should be altered in the diet, which supplement needs to be added, which seeds should go proper with this patient, that also can be catered. and gradually we will see the microflora of that patient is changing. And as we know, the microflora changes, there is a strong connection between a gut and brain. The brain activities, the cognitive actions will always change. And once the cognitive actions change, again it will direct the body to perform the activities in a better way. So this is how the VCS cycle works. And here is the role of a dietitian, a nutrigenomic dietitian, to give a proper intervention, which I think this 15 minutes I won't be able to do justice with this topic, because this is a vast topic, and explaining each and every term like shotgun sequencing and like elaborating these genes, all those 20 genes and their effect and how they work will require time. So I will request all of you, if you can just squeeze your time from your busy routine and you can understand the course in detail, that is really going to help you in your patient service. So now here is one case study, some tests for planning the patient's diet, which I just described, that there are certain tests which we do, that is the DNA testing. Apart from that also, we have certain tests which help to understand whether that person is uh, prone, or that person is more susceptible or tolerant with that particular food. So by understanding, for example, if I take the case of IBS, next slide. Next slide. Yes. So if I take the case of IBS, there will be patients in your clinic who will be coming and say that I need some tea or coffee in the morning, else I don't feel like to clear my stools, because this is a very common problem for the IBS patient, because they have a irritable bowel and they have the bowel issue also. They don't get clear every day properly in the morning every day. So most of them have this caffeine intake issue. And being a dietitian, you can't say blindly every time no, because they will come to you and they will say उस डाइटिशियन ने तो बोला था खाने पीने के लिए, तो आप मना कर रहे हो. और they will come and say that I don't feel any problem while having coffee. Then you should be confident that caffeine is something which doesn't create problem for all. There are individuals who have higher stimulations for caffeine, and there are individuals, as Tanveer also said, lower in stimulation for caffeine. So every individual is different, and that also comes with that genetic report. So basically we have to work on that genetic report, on that provided DNA report, on those genes, understanding those genes, their effects, their dietary therapies, and then gradually modifying those dietary therapies to improve the metagenomic effect or the metagenomic action of the body towards the disease, so that we can work on the grassroots level. That's all, guys. So any questions? Anything, any question, or I shall ask questions?
So that we are doing in quiz, Deblina. So
Okay,
I have
okay,
collaborated all the questions from each one of
done.
you, and there will be a fun quiz wherein we will be sharing the leaderboard. देखते हैं who will be the fastest finger, and it's time bound, 20 second का time है. So not wasting much time, shall we start? And if you have any question related to the content or course, like what we have taught now, you can obviously ask after the quiz. Yeah. So are you ready? So this is a scan code for the quiz. So you just need to scan this code and get this. Or if you want, I can share the link in the chat box. Just give me a second. So once you start once you scan or click on the link, you will be directed to the website or Slido, wherein you just need to add your name and you can get into the quiz. So I'll just share my, if all I have just copied, I will just share my this screen of Slido.
Yeah, but I think Fatima, I think once we sign in, I hope they are able to do the assessment because
Yes. Once you sign in and once everyone sign in, I will start the assessment and you will get the question on your screen itself. Yeah. So it's no need of me to read this question, but still I will read the question for everyone.
yeah, I think I can see 6 users joining.
Yes. So we have like 16 people, right? So right, others do quickly join in.
Fatima, you can go ahead, I feel, no problem.
Yeah, okay. So we can go ahead. So here's the first question. So property of genetic code being universal. So you can select any one answer. Why it makes it universal? Is it same for all living being? Only human use it, or it varies from plant to animal, or it's applicable in DNA? So now it's time to reveal the answer. It's same in all living organism. Now we are saying this because the base like AGU, what we have talked, the Ankita told in start of the lecture, are code same for everyone. That code, base code doesn't differ for any, it doesn't differ from animal to animal, human to human. The code, the starting initial code, the base of the code are same. Yeah. So that's why it's like it's same for all living organisms. What are the start codon for mRNA? If you remember our college days, UAA, AUG, UGA, UAC. So the right answer is AUG. I think maximum have got the correct answer. We move on next. The genetic code is described as degenerated because multiple codon codes for same amino acids. Codon can code for multiple amino acid. Every code, codon code only for one amino acid, or stop codon codes for amino acids. So these all things we will learn better way in our course. So the correct answer is multiple codons codes for same amino acid. So there are many codons which codes for same amino acids. It's not only one code for one amino acids, multiple codes are there. And because of that also there are too many mutations taking place. Mutation hampers the amino acid profile also. How many codons in total exist in genetic code? If you remember our genetic lectures in our college. Because I think this 63. It's 64. Yeah, good enough. Now, nutrigenomics is primarily a study of how food affects the health, interaction between nutrition and gene, energy balance in body, or how exercise modifies metabolism. I think it's pretty simple for everyone. Bang on, everyone got it correct. Which nutrient is linked to MTHFR gene polymorphism and folate metabolism? Answer is there in the question itself. So without wasting much time, we can reveal the answer. Correct. Down syndrome is caused by mutation in X chromosome, trisomy, absence, or mutation. थोड़े simple भी रखे so everyone can get it easily. %83% people have got it correct. PKU occurs due to deficiency of which enzyme? %100% correct. We move to next. Maple syrup urine disorder. MASUD is named because it causes excessive sugar in urine. Urine smells like maple syrup, or it is related to maple syrup diet, or urine color is resembling maple syrup. So everyone got it right. Good. मतलब सुन रहे थे सब. Galactosemia results in inability of metabolism of glucose, lactose, galactose, fructose. Boom. Now, what is the primary goal of metagenomics? To identify individual microbial species in laboratory culture, to study the genetic material of single isolated microorganism, to analyze the collective genome of microbial community, or to determine the metabolic pathway of specific bacterial species. It's to analyze the collective genome of microbial community in the natural environment. In metagenomics, we don't determine the metabolic pathway of a bacteria because that will be beneficial for bacteria. We do metagenomic testing for human benefits. So we study the genome of microbial community which are there in the human gut in a way that help us to determine what kind of diet we can give them to get that perfect balance of the good bacteria and bad bacteria in our gut. Okay. Which of the following is a key feature of metagenomics? Culturing of microorganism in lab, analyzing DNA directly from environmental sample, studying individual or isolated microorganism, sequencing the genome of bacteria. I think here again people have confusion. Metagenomics is related to microorganism, but we are not doing anything with related to microorganism. Like we are not doing the culturing, we are not testing isolation of any microorganism, but we are just studying their DNA sample, which can help us to get the better gut flora for the human being. So analyzing DNA directly from the environmental sample is the correct answer. Which sequencing method is commonly used? Sanger, automated DNA, capillary, or next generation sequencing? I think if anyone can say, let's see. This is out of the syllabus. We are using next generation sequencing, which gives much more better DNA profile compared to automated DNA sequencing. Which of the following is an example of metagenomic application? Studying the genome of a single bacteria, analyzing microbial community of the gut, human gut and impact, or determine the metabolic pathway of single enzyme, or sequence genome of virus. So correct is analyzing the microbial community of the human gut and its impact on the human health. Gaucher disease is caused by deficiency of which enzyme? Glucocerebosides, alpha galactosides, hexamines, or phenylalanine hydroxide. So the correct answer is glucose cerebrosides, which is the main enzyme deficiency in Gaucher disease. ADHD is primarily linked to dysregulation of which neurotransmitter? Dopamine, acetylcholine, GABA, or serotonin? The correct answer is dopamine. Primary carnitine deficiency affect which of the major metabolism? Protein, fatty acid, glucose, or vitamin? It's fatty acid oxidation. So this is the transporter which uptakes the fatty acid for the metabolism. If this is deficient, carnitine is deficient, then fatty acids are not taken up for the metabolism. Individuals with lactose intolerance usually have variation in which genes? So I think we have talked about all the genes in brief, so you can answer much better. So it's LCT genes. Which genes variant is linked to dictate the It's CYP1A2 genes is the main who dictates the speed of individual who can metabolize coffee. MELAS syndrome is primarily caused by mutation in nuclear DNA, mitochondrial DNA, Y chromosome, or ribosome. So here it's mitochondrial DNA. Yeah. And here is the final leaderboard. Let's see who has done best. Shruti has got 17 from 20. Anita has got 16 from 20. So congratulations to the first three person. Third is a Tanveer. Yeah. I will stop this. Wait, I will just stop sharing. So just a quick assessment. How did you like the workshop, Abhika? Did you learn something new or you were knowing this already? If anyone can just unmute and tell us. No one?
Or do you all have any questions
Yes.
regarding how the course is going to be and specifically? Oh, thank you, Arena.
Thank you.
So,
So
Fatima, go ahead and tell about little bit about the course details and everything, and probably we can
yes,
try to understand if they're interested into going ahead with the course.
sure. So the course what we are talking about is 6 months. Course we are talking about is a 6-month course, Diploma in Nutritional Genomic Mastery. So it's a professional training wherein you will get a deep detail about this, all the topics like introduction to genetics, about nutrigenetics. Then you will also learn about more than 10 plus inborn errors and more than 10 plus of genetic disorders, rare genetic disorder, how to assess, which genetic testing you need to do, then how you can give a tailor-made diet to all these diseases. You will learn about nutrigenomics and this metagenomics in detail, how this testing can benefit your clients. So all these things will be there. But along with that, the main hero of this course is like you will get real world nutrition plan to plan. Like you will be given a case studies wherein you need to plan. A hypothetical case will be given, or even life case can be given for you to practice how to plan about these conditions. So that will be there. This course is completely online. Weekly classes will be there, weekly once, and it will be for the 6 months. First 5 months we will be teaching, it will be a theory base. Last 1 month will be case based practice, wherein you will be evaluated on that base only. And at the end of this, you will get a certificate of completion from the renowned institute, NIND. So it has internationally accredited organization. So certificate is valid all over. So do you have any questions, or how do you feel about this course? How many of you would like to know and get enrolled in this course? Ankita?
Yeah, Sinta, Ujwal, Zara. Yes, Zara. So Zara is asking what is the when is the course starting? So Shruti will update you about when is the course starting. Probably I think in October we will be starting the course, and we'll give you the confirmed date. And according the fee structure, Fatima, the fee structure you can explain.
Yeah. The fee structure for this course for the professional is 20,000. So those are working professionals is 20,000 for the whole 6 months along with the training at the last month. And for students, it is 15,000. But if you spot register, since you all have attended our workshop, you all have taken out your time for the workshop. So we are giving flat 15% off to all the participants who are there in our workshop. So we will be sharing the payment link, right? We can share it here, or we can share them later.
You can share it here. I mean, probably they can take a quick call, and I mean, and outside these courses are lakh rupees course which we have invested, and we are giving it to you at a very, you know, valuable rate, I would say rather. And it's just not only the 1 week of the duration which will be there, but there'll be a group which will be created with you all, with our mentors, where you can actually keep asking your queries, questions, and you'll so it is going to be like a 6 months journey probably. You know, a lot of learnings and hand-on experience from case to case. Like, you know, we'll be once we finish one module, we can practice some cases also. So we'll plan that out during the 6 months of time specifically. So Anita, Shruti, I think uh, we've just kept the link on the. Fatima, you can just share the link on the screen,
Yes,
and
yes.
you just want to even, you know, pay some minimum amount of 500,000 and pay rest the amount in some 2 3 days of time. That can also work. At least you'll be able to reserve your spot for the course specifically, because we are not taking more than 25 enrollments at a time.
Yeah. Because we wanted a small, even we want a smaller batch so that we can cater and educate them and teach them much better way. Because we are not focusing on masses, because फिर वो reach इतना नहीं होता अच्छे से. A small batch is also okay. So we have a limited seat here, but I can assure after this course you will be confident enough to handle any cases, right?
And
Ankita?
also, I think, yeah, and also in few cases, we will be doing mock sessions also, like
Yes.
specifically with the genetic testing. If we are giving hypothetical case to you specifically, so we will be doing some mock sessions also, depending on topics to topics specifically. So it's going to be like a lot of practical application rather than just learning about the theory. And you can always apply it to your patients, and if you are associated with any lab, you can always upskill your profile also, being a nutrigenomic counselor or educators, you know, specifically. So Anita, Shinta, Zara, can we just unmute and have some feedbacks from you all? Arena, can you just unmute and give some feedback, or can you just interact?
Hello.
Yes.
Yeah, so the session was very, very informative and engaging. The examples made the concepts easy to understand, and I especially appreciated the practical application shared. So it was really, really helpful. Thank you all. It was really very, helpful for all, maybe.
Sure. So, Zara, when can we expect you to enroll for the course?
Give me some time, Ankita. Maybe by tomorrow I can decide and let you know.
Sure. Fair enough. We'll just wait for 2-3 minutes for you to give us the feedback or ask any questions or anything, any query you have, and probably our we can just get back to you.
Sure, sure. I have one query here. So basically, the people are a little reluctant when it comes for, lab testing, when we talk about the country like India and, coming to a nutritionist and paying even 7 to 800 is a big deal for people where we live in. So do you think having DNA testing and, stuff like that is, how can we convince people when they are still reluctant to take simple blood tests, lab tests, and having DNA tests is little advanced is what I think. So what's your take on this?
So I'll tell you, Zara, and
Yes, Zara.
I'll answer your question. Yeah,
Yes.
Debrina, yeah, you want to go ahead? You can go ahead.
So, yeah, thank you, Ankita. So, Zara, the example of mine which I have said, it was the year 2015 I am saying about. So, at that point time also, the elite classes were very much aware about the DNA testing, and they were having this concept very much clear in their mind. Okay, out of n number of diet, which diet is for me best suited, I have to know by my genetic reports. Because if I am not wrong, and all of you must be agree with me, that these elite class people, they always have a dietitian with them. Now, this is the story of 2015 of Kolkata, and this is 2025. So, it's 10 years later. DNA test is not like that. We have all need to take the blood sample. It can be like the saliva also. The way how we used to go, we used to take the kit, the DNA kit to the people's home. It was containing a tumbler. The way people give their stools, they give their spit, their saliva, thuk dete the usme. And from there it took almost some 25 30 days time. It goes to Bangalore for the testing, and then it come to us with the detailed genetic report. And then we dietitian used to decode those reports and analyze them, and accordingly we set the first dietary principle for that patient. And then accordingly the follow-ups were set, and then the metagenomic role comes when the 3-month follow-up was there. So the things were very much clear at that point of time. So now it is much more clearer. It's only that we need to search for these things. Now, how we can search? I am also teaching online platform for this autism patients. There are companies which sell this supplements like keto supplement, autistic powder supplement. Then why for them this thing is clear that keto can be given in hot and humid weather of India also. So definitely some genetic research has been done by their companies. Then here also the DNA, the genomic studies, the nutrigenomic applications, they have already done the studies. So maybe we need to more deep dive. You need to understand what is going on in the places. But I will say that it is much more acceptable now. It is not like that ke मतलब 10 साल पहले भी it was like that people were knowing. तो अभी तो people are very much knowing that.
Okay, got it. Thank you. And Deblina, one more thing I just wanted to ask. Bangalore, where do we have this DNA testing done, genetic, testing done? Do you have any idea?
in Bangalore, if I am not wrong, it was somebody called Aditi. Her own clinic was there. So right now, I don't remember the proper clinic name, but that was the first. Like she was having that brainchild. Now, presently, she is having many courses. Recently in Kolkata, also they have done some courses. So they have their, or they mostly they ask these patients to give the DNA sample with their consent form so that they can make a complete profiling of their DNA and they can send it to customers. It was at that point of time 30,000. I think it has been reduced more, 5 6,000 now.
Okay,
Also,
okay, got
Zara, there is a lab, there's a proper microbial lab which I give my samples to, my patient samples to Pune. So Pune, there is a lab. Bombay also, there is Velocity Karke, there is also a lab basically which do all these testings in which actually give you in-depth report. And coming to answering your earlier question about the pricing and the client. So yes, so this is not for somebody who is looking for a regular personalized diet for 5,000, 6,000. How you place yourself, the awareness and the niche market, what you target is something which you have to look forward for if you want to work into this field of nutrigenomics. So your target audience is always going to be somebody who's already spent 50,000 but have got no results, basically. So how you also position yourself as a counselor, as an educator into this field will also attract a lot of people. People are okay to spend if their health and it's going to save a lot of lakhs of money. Say for example, you can always promote yourself or build, if you know the subject well. When you learn the subject well, you always have to promote it in terms of, if you want to save 2 lakhs of your heart on spending on your heart surgery and investing a little, investing 35,000 is going to save you lakhs of money, and not only you and your coming generation. Some extent is something which they are really convinced and ready to put in their investment into health. So it's all about how you place and position yourself into this category is very important.
yes, well said. Yes, I agree.
Yeah, so unless and until you know the subject, you'll not be able to promote it, you'll not be able to counsel it, and you'll not be able to the second way I've always told you, you can always collaborate with people who are already doing it, and you can, if you are not that confident enough at initial level, you can collaborate with fellow members who are already doing it, and give your samples to the best lab which are giving results basically.
Okay, thank you so much, Ankita.
Yeah. Yes, Fatima, you wanted to add something?
That only. So basically, even when we practice nutrigenomics earlier, it was very difficult to convince people. But now, since we know कैसे समझा सकते हैं कि अभी आप invest करोगे, बाद के आपके पैसे बचेंगे. Because there are few clients who have spent lakhs, or I would say thousands of rupees on the supplements. वो 3 महीने के लिए लिए हैं. I don't want to name the supplements. They have taken that supplement, but once they have left it, they have come back to the weight gain, weight what they had earlier. But this testing have helped them to sustain that weight loss and even get the better profile, like diabetes reverse हुआ है, lipid profile better हुआ है. So bit counseling is required before offering these kind of tests to them. So पहले उनका mindset जानना जरूरी है, what they have been through वो जानना जरूरी है. Already उन्होंने अगर इतने पैसे भरे हैं बाकी चीजों में, and if they convince कि हाँ ये one time investment है on my health, they are ready to pay for it.
Yeah, okay.
Yeah.
Plus, I would like to add, like DNA testing, our prices are going down, and courses for this subject courses prices are going up. This is happening
Actually.
because these tests are for classes, not for masses currently, but later on you will be having it on masses as well.
So basically, who are the mentors who would be giving, classes, and what are the topics that you're all going to, cover during this diploma course?
Yeah, so we can share it with you, Zara. We can share the modules with you about the course topics and all that, and probably you can do. Fatima, if you have, you can show it on the screen. If you can show
Yes,
it
yes.
to her.
I'll just yeah, I'll just open. Wait a second, I'm just sharing my slide. Is my screen visible?
Yes, Fatima, we can see.
Yes,
Yeah.
yes,
So Zara, if you can see, yeah.
So these are the
Yeah, yeah.
modules. Yeah. So we have fundamental of genetics and nutrition. So this I have taught, but in each you will be learning like basic of genetics. So like what is DNA, RNA, basic, because वो थोड़ा missed out हो जाता है कभी कभी. So just brushing up, then genetic variation like SNPs and mutation, what are there. Then principle of inheritance, because there are few mutations which are inherited. So principle about inheritance will be taught. Then effect of macro and micro on the metabolism of genes will be there. Gene nutrition, nutrient interaction, basic will be there. So and advanced will be taught in the third module. Second module you will be having introduction. Then each disorder of this carbohydrate metabolism, protein and fat metabolism will be dealt in detail, where we will be talking about pathophysio, clinical presentation, MNTs, and diet planning for each of these. So approx I think it's like 10 to 12 disorders. Same goes for the genetic disorders. There are chromosomal disorders, single gene disorder, neurogenetic muscular disorders, mitochondrial lysosome disorders. So they are categorized in the classes, and we will delve each. We will learn about disease, clinical presentation, how to diagnose, what are the challenges, and how we can help to overcome these challenges, and MNTs what are required for these conditions. So few are very well-known disorders, few are very rare disorders, all will be covered, and most of them you will get to know the case studies, how we can deal with it. तो ऐसा नहीं है कि खाली theory होगा, but case study के साथ होगा ये सब. Then for nutrigenomic concept होगा, differentiation between nutrigenomics and nutrigenetics. Then about the gene interaction, how to interpret the reports वो रहेगा. Then what are the effect of each genes on our metabolism, how you can plan a diet for this, interpreting the reports will be there. Yeah. And in metagenomics, microbiome composition significance रहेगा. What are the symbiosis and dysbiosis of this microbes in our intestine, and what are the disease implication, because as we say, our gut is a second brain, and our gut talks with our brain. And so there are many gut axis, gut brain axis. Then you have gut liver axis, gut kidney axis. So all these things will be discussed in this. Then basic of metagenomic techniques and tools, how to interpret the data, how to understand antibiotic resistance in gene gut. So all this will be dealt. Then we'll talk about prebiotic and probiotic role. Then we'll also deal about personalized gut microbiome nutrition strategies, how to interpret. Basically, in this fourth and fifth module, you will be taught how to interpret the report and how to give the plan to the patients you are dealing with. And last will be the project and the this project and the thesis work. I hope that's clear. So there are too many things, and since we want to educate masses, so we have kept the price so low. One, I think, like Ankita told, the pricing of these kind of courses are too high, right? You know better. So you can avail this many things, this many amount of knowledge, and at such a low price, because since we want to address the masses and the newcomers जो है उनको भी affordable हो जाए, so we have kept it this kind of low. So you all can just let us know your answers by tomorrow. So we have this offer for you all people, only those who have taken their time and attended a workshop. So I was just giving this offer to you all people. Link chat box में है. If you want, if you can't access that link, you can just message any one of us. I think that would be fair enough. Yes, Ankita?
Yes.
You can contact Ankita, you can contact Devlina, Tanveer, या Ritika or myself. So we are happy to help you. और अगर कुछ और questions है, if you don't want to ask now, बाद में अगर आपको doubt आता है regarding post, we are here to help you out.
And anyways, I think the NI team will also get in touch with you in terms of yeah. So I think that would also help, and you all can always ask for help wherever you want. Yeah.
Yeah, I think it was all clear. Thank you very much. Thank you all. And I'll definitely update you by tomorrow, maybe in the end of the day by tomorrow.
Sure.
Sure.
All right. Yes. So see you, everybody. See you, Arina. Thank you, Shruti, Arina, for joining.
Yeah. Thank you, Zara, Shruti, Arina, Taranum, for being there till last with us.
Yeah, I know. I think it was really quite interesting, and it really helped us also to motivate you all. And I mean, education is something which everybody should look forward for upskilling. Because if you're not upscaling, you're not growing.
Yes.
All right, so we can wrap up, Fatima. And
Yeah.
all right, thank you, Tanvi, Ritika, Devlina. I
Thank you.
Thank
Thank
you,
you all.
everyone.
Bye.
we've had a great session today.
Likewise. Bye.
Thanks,
Bye bye,
everyone.
everyone.
Yeah,
Have a
Bye.
great
Expecting to see
evening.
you all.
yeah. Fatima, you want us to wait?
No, no, no. I think Charu can end this meeting
Yeah,
for all.
Charu can end the meet probably. We can leave anyways. All right. Good night, guys.